How is a lymph node biopsy done for lung cancer? Have you ever wondered how doctors determine if lung cancer has spread to lymph nodes? A lymph node biopsy is a critical procedure in this process. It involves removing a small sample, or sometimes the entire lymph node, tissue to check for cancer cells. This helps in diagnosing and staging lung cancer. The procedure is usually performed by a surgeon or radiologist, and the tissue is then examined by a pathologist under a microscope. There are several methods to perform a lymph node biopsy for lung cancer. One common method is mediastinoscopy with biopsy. This surgical procedure is done under general anesthesia. The surgeon makes a small incision above the breastbone to access the mediastinum, the area between the lungs. A scope is inserted to visualize and biopsy the lymph nodes around the airways. Tissue samples are taken from lymph nodes suspected of containing cancer. After the biopsy, the scope is removed, and the incision is closed with stitches. This method is often used to stage lung cancer by determining if cancer has spread to the mediastinal lymph nodes. However, there are risks involved, such as potential injury to nearby structures like the esophagus or blood vessels. Another method is the ultrasound-guided lymph node biopsy. In this approach, an ultrasound scan is used to locate abnormal lymph nodes. A needle is guided by ultrasound imaging to the lymph node to remove a tissue sample. This procedure is usually done on an outpatient basis and is less invasive than a surgical biopsy. For lymph nodes that are deeper in the chest, computed tomography scans may be used to guide the needle instead of ultrasound. Endobronchial ultrasound-guided biopsy is another technique that uses a bronchoscope equipped with ultrasound. Under sedation, the bronchoscope is inserted through the mouth or nose into the airways. Using ultrasound guidance, a needle is passed through the airway while into the lymph node to collect tissue samples. This method is minimally invasive and allows for sampling of lymph nodes without the need for surgical incisions. It is widely used for lung cancer staging because it provides accurate information about lymph node involvement with fewer risks. In some cases, a computed tomography-guided percutaneous biopsy may be performed if lymph nodes or lung nodules are accessible through the chest wall. If less invasive methods are inconclusive, open surgical biopsy or video-assisted thoracoscopic surgery may be necessary. The choice of biopsy method depends on the location of the lymph nodes, the patient's overall health, and the need for accurate staging. An accurate lymph node biopsy is crucial in lung cancer care because it determines the extent of cancer spread, which directly influences treatment decisions and prognosis. Patients should receive detailed information about the procedure, including preparation, benefits, risks, and potential complications. While lymph node biopsy is generally safe, there are risks such as bleeding, infection, or injury to surrounding structures. These risks are carefully managed by the medical team. In summary, a lymph node biopsy is a key diagnostic tool in lung cancer care. It provides essential information about whether cancer has spread beyond the lung, helping to guide personalized treatment plans. Always consult with healthcare professionals for personalized medical advice regarding any procedures or concerns.